go around Lisa to do it, but I'll just, you help me, I charge extra. So as you can see, I haven't even started her head and all this now. If I was giving her a lesson, one of the things I'd want to work with is her head is off to the side. So I would want to make sure that she's okay there. But no. When you do this, okay, this is what I want to show you with correction. If I take this, okay, so go, now see she's got this hole here, so it could have been doing this.
Yeah.
Also too, not to pick on you, and this is probably not the case, but usually also people that are older might be harder in hearing. So they might also have the good ear up, just even subconsciously. Because my mom refuses to get hearing aids, but she'll be like, talking to this ear, get hearing aids. But if I were to go like this and say, oh Lisa, you're supposed to be here, I think she'd probably find this a little awkward. You know, and now she's going to go, well, what's wrong with me or whatever. And again, I would never tell her this if she was my client. Unfortunately, I'm teaching you guys, so. Is it getting cool in here? I don't know.
Yes,
I'm fine.
I can adapt.
I was just thinking.
So,
Her body also, her leg shifted.
yeah.
Her left leg.
Yeah, it's called Take Away the Personalities. No, but this is what I'm talking about. We have our internal stuff and we have our environment, and the way we respond to stimuli is going to be different, whether it's hot, cold, just simple little things, but.
And I have to walk by the food.
What?
You're talking about, she was saying she was just getting why it's really important not to adjust the body.
Yeah,
I've gotten it in my head and I've heard it over and it's just been so hard for me
right,
to break that habit.
right.
And so I'm like, okay, I feel like I
You got it?
get habit more of it.
Well, just look at it this way. What if I went and decided what you were supposed to have for breakfast every day and made it for you? Or one of the things I tell the seniors, what if I told you you had to eat oatmeal for every meal for the next 30 days? Most people actually get pretty angry with me pretty quick just from saying that. Now, it's not going to kill you, it's not going to be bad for you, but just the thought of that repetitive food-based system, and because I told you how to eat, your system's going to be like, oh, no. That's why it's so hard for us to lose weight, because we go to people to advise us how to do it, and they don't take ourselves into consideration, me, myself included. We're like, I'm getting these giant breakfasts, and I don't have the heart to like not eat it all, because he's put so much work into it, but. So I'm just going to go around. Now I already want to work on Lisa, but that's okay. I'm just going to quickly go around and this is just what I'm looking for. Just this little bit. Do you see how easy it is to check? I'm not doing anything special. Yes, no? Do you not see? See? It's a little weird that everybody's looking at you. Close your eyes. Pretend we're not. Yeah. So, it's just a real quick, but I've done this enough, and you'll get it with practice. Now here, can you feel a little bit that word there? I want to work maybe a little bit.
Yeah.
See, can you feel that staccato? A little bit harder to bring up this arm kind of thing, but still. So just feel again if I go here versus here. Right. It's just subtle. And just right underneath. Now I'm not going to do a spinal rotation because she's an adult. Now see how nice her head is? But now what I'll pick on over here so you guys can see it more, and this happens to be an arm, I'm just going to grab my chair. Excuse me. If I need it, I don't know. So just to show you, someone was surprised yesterday that rotation's in every part of the body, but so I'm going to look at the hand again. So see if when you pick it up, for those of you that are into reflexes and stuff, that it's hard for her to present. But basically to me, what I would work on more so is that wrist needs to know both sides of gravity, how to come up in gravity, but also how to come down in gravity. So just feel as if the wrist was, like if I had a string and I had a string kind of thing. So if I go here, so she's already adjusting for what I said, but she still doesn't, the hand doesn't drop down. Also, her hand is very light, so that shows me she's, whether she knows it or not, she's helping me a bit. Because otherwise, you know, it would be a bit more heavier. But again, if this is what she knows, she's an OT by trade. I joke around with some adults. She might be like the oldest female in the family. She's used to being the helper more. You know, these kind of things show up even when they're on the table. I can tell people too, youngest child, because this shoulder wants to do this, so someone's already doing, drag them around. You know, so I'm just going to look at, which is not a part of the assessment, but just to show you, but see how the rotation should be in every finger. And I really feel, do you feel the middle finger doesn't want to rotate as much?
Are you checking both directions? Is that-
Yep. So you can do it with your own fingers to just feel what it's like to just lightly do this. Yeah. And then if you get, you know, see, this is what I was showing you yesterday. This is why the sliding filament just wasn't making sense to me. Now screw the thumb in and screw this. See how the hand moves around? That's why I was cellular structure just perplexed me. I'm like, it just can't be right. So now already, look at the difference. See how she's starting to respond? She still gets to about here, there. See how she's trying to help me? So I'm just going to concentrate here. Here meaning I have my one finger underneath her wrist, and I'm just looking to add that rotation of the finger around the wrist. You will get this kind of hand for someone too that's very into manual trades. There we go. Horseshoers, people that hold hammers a lot, very kind of where the wrist also wants to. See now again how she counters through just that little bit of a hand. All I'm working on is just that finger rotation. Now again, just to see if that made a difference. See now already how I can bring that hand up. See how that changes the hand positioning. Can you feel the difference, Lisa?
Mm-hmm.
It's very tempting to want to push down here. I'm not.
So you're not doing, what are you doing with your left hand? Is it just
The left hand, I'm supporting it, but I'm getting input to the wrist joint. So here, if I just come to you briefly. So I'm just here, but I'm just, see how you don't want to give me your weight, right? And I'm just, see if I was here, now you would want to be habitual with your muscles. I'm just there. I'm just waiting for her to allow coming into that hand. But that counter is still important. But right now, I'm still just on the pointer finger in with the wrist. There, now she's starting to roll over. But if your son plays piano, don't help him. I'm teasing you, sorry.
So what's the effect of not having this, I don't want to say, I don't know how to even word it, integrated, not having access to this rotation? So like, because my hand is similar or has been similar, and it's like, okay, so if I don't do that, if it doesn't get worked on, I don't get that flowing with rotation, what is the secondary effects of that?
Well, you saw that more with April yesterday, so I worked on April's hand, right? One of the significant things with hers presenting and sitting. So she now, actually from the way that the hand rotated was the other hand, so coming up to this side was just, you know, it was, I could come up. The other side she had to manually lift out of this. So let's say both hands were left unchanged. The real significance is when your might can no longer supersede the mass. So that usually shows up in seniors, people of age, with their first surgery. Now they can't get out of bed because up until then, they didn't realize how much muscle tonus that they were using to get out of bed. You'll see the same thing with like 12 to 15-year-olds with CP. They could walk, and all of a sudden they just can't walk anymore, especially after they've had like trauma, flu, or something like that, where their system loses that relationship that they had with their environment, that vestibular relationship that Lisa was talking about, or asking about. So, and all of a sudden they just can't walk anymore, and that's where the parents go, but he was walking up until now. Well, really he wasn't walking. And it was might-based versus using these principles, and at some point, they just don't have that effort, and they're smart enough to say, because they get too big, I can't do this anymore. And when the brain says, I can't, whether it's a senior or a kid, that's the worst form of aging. And we're not talking about, I can't go to Wimbledon. I know I can't go to Wimbledon, and I'm fine with that. I'm talking about, like, I see it with people of age. They don't go out anymore. Why? Because they can't get off a public toilet. They don't, like at home they have that stuff, but they don't have that way to get off so they start avoiding conversations, or they don't have night vision, and they might, put off social engagements because they don't know how to drive there and get back. They don't have, when those things happen, when that person is allowed to succumb to their environment, you know what I mean?
Can you say it's optimal movement versus compensatory movement? I mean, as you get older, the compensatory movement falls apart.
Yeah, that's another way of saying it. Yeah, absolutely. But I'm trying to teach you in my Pig Latin, along with the newborn assessment, that there are natural forces around us that we manipulate through and not because of. And if you really learned how to use these to your benefit, the system just takes off, because that's how it neural maps. And I don't think anybody's looked at that we neural map based off opposing gravity versus coming in. Is this our first or another one?
I thought they were just walking to the pool.
So see now, there she goes. She can go all around.
So you did the more of the rotational work, and then you picked up momentum because it was now rotating, and you were checking different areas. And
I also was looking to see where her relationship to gravity was. And before we started, she was here. And now this wrist can start floating also in and out of that conversation, which wasn't happening. But yes, that relationship of just rotation to the wrist allowed that kind of movement. But with that, so now play with your other wrist. And play with this wrist.
wow.
Pull it down.
Right? So now I'm here with an object. So now just reach up with your right hand for that. See how she naturally will want to rotate in through that. So come back down, and now your left hand. See the difference?
Oh, wow.
Yeah. How?
Do the right hand again, please, Lisa.
So you can do the same thing. I'm going to take these out. Sorry. And now just try coming up to sitting to your right side, to your left. Now if it's... So that's that way. Feel different? Yeah. But does that make more sense though, how I work on the hand and how it affects the system, and then when the system changes, how it affects to where it is responding to the...
A lot of, well, some students need braces. Or even when it's severe, like have metal rod, they have metal rods up their back. So when they're like, so for instance, I have one student who has a metal rod up her back. So it's like she can go here and then straight up.
Right.
And she's an adult now, and she just does what she can.
Right.
She knows she.
So now do that again.
So she can roll up through her.
Put your
lower
feet
back.
down on the ground. And show us what she's doing.
So she can roll through her lumbar, but then
Okay.
she gets to her metal rod, and then it's
So now, just take your feet and just look slowly, just forget your back, just rock your feet, so just rock slow, no, don't take your feet off the ground. Rock them to the toes, and all of you guys can do this if you want, come to, exactly, and now come back to your heel. But don't take them off the ground, just feel that inner rocking. Just slow it down, keep. And now I want you to slowly rock the left foot. And I want you to slowly rock the right foot. Notice how the one wants to come off, just notice that. And now what I want you to do, when you feel comfortable, rock the right foot into the left foot and back.
Really want to lift.
Right. So now, pretend you have a rod on your back and come over and sit up. Feel the difference? Yeah.
It feels like you can like,
So again, not to cut off tracks, but one of the things you really have to work on with rods, I look at rodding is like you ever see the slow-mo crash test dummies when they do into the car, into the wall winds? I don't care how you rod, you have a neurological system that wants to do curvature of the spine, and that energy will never dissipate unless you work with it. So to sit there and not especially work with the pelvic region and the chest cavity so has to be manipulated and softened up. Because I don't care how you put the rods in, then that curvature will start showing up, and that's where I think you see a lot of the chest spinning, or especially the pelvis starts to spin. The rods will be straight, but you still get the dysphoric features, which to me are even worse.
Yeah.
And these guys got to see it in class with Mia, that will continue with the human body. And but it needs to be worked with. You can't just, again, fix somebody. It's the nervous system. The nervous system has to have transition. So, like I said, if I said you needed to eat this way, all of you for the next month. Yeah, you just, it's not easy. It's the same thing with the babies.